Try this stretch if you are struggling with sciatica. Sciatica is characterized as shooting, searing pain from the back into the buttock, and it can go all the way down the leg, even to the toes. This stretch is very, very effective. It's also very safe, and it's not going to cause any issues long term. And if it's done in the correct way, it shouldn't cause any side effects in the long run as well. So my name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey. And we help people with chronic lower back pain and knee pain avoid a lifetime of painkillers and surgery. So one of the side effects of chronic lower back pain is disc pressure and sciatic issues. So when a disc can prolapse or slip is the common term, the disc does not actually slip, it's just pressure going through that lower area. That can then press on the sciatic nerve, and that can cause shooting pain down into the buttock and also down the leg. It's very, very important that we first diagnose what's causing the sciatica, and then secondly, for yourself, the patient, it's really important that we get pressure off so you can start feeling better. And then thirdly, really important that we prevent the problem from coming back in the future. So we get everything strong, get the core nice and tight, to allow the patient to get back to being active, mobile, and staying fit in the long run. So let me talk you through this exercise. It's very, very simple, and it should give you some immediate relief, and also you can keep on doing it long run. Now, a couple of things to note. Please consult a medical professional if you are concerned about doing this exercise, and make sure that you've signed it off with your medical professional as well. If you are struggling with any bowel or bladder issues, so any incontinence, then it's really important that you seek immediate help as well, A&E. That can be an emergency for any sort of sciatic issues as well. Okay, so let me show you this. Okay, so let's start off here. So you need to get a wall or a door. I prefer a wall because it then means that someone's not going to walk through the other side of the door. So let's say, for example, that I have got pain on my left leg here, okay? So I'm going to then lean my right side up against the wall. So what I'll be doing like this is essentially having my hips up against the wall like this. And can you see how I'm getting a bit of a slant on the hips like this, okay? Now, what you then want to do is you want to try and drive that hip with this left hand here. You want to push on top of the hip, so not in the fleshy bit here. You want to push on top of the pelvis like this. And we're really trying to push into the wall like this and try to get as much flexion as we can through here. Now, what this is going to do is going to take a lot of pressure off that left hand side sciatic nerve. It's going to cause a stretch down through the side here, and it's going to be very effective at taking pressure off of that area. So you may want to try this for 30 seconds, and it's a very light, gentle push down through here, and repeat this 3 times through. Now, if you're struggling with sciatic pain on the other side, obviously you reverse it and then do it down through the other side there. But the idea is it's trying to gap the joint, it's trying to open up the nerve, and then take pressure off of that area. Let me show you from a different angle as well, okay? So again, remember, this hand here, top of the pelvis, and we're trying to push that into here, taking pressure off that left leg. Remember, keep your shoulder blades back, keep your chin tucked back in as well. You don't want to be hunching around like this. And we're going to hold this for 30 seconds, and then we relax like this. And then back in for 30 seconds, and then relax like this. So I'm just going to do it from behind as well so you can see, all right? So again, this would be if I've got pain on the right hand side here. So I'm really trying to push that hip in like that. Push it not as hard as you can, but you're just trying to get some pressure off. If it's causing too much pain, then just drop off like this, and then come back in very gently, like this, okay? Okay, so that is a really simple way to get started with sciatica relief. There's lots of other videos on this channel that you can use as well to start getting some pressure off of your nerve. The key thing is to avoid any sitting for long periods of time, and also avoid any loaded flexion. So what that means is crunching down like this and then loading up your core in flexion. It's going to put a lot of pressure on the disc and the sciatic nerve. So things like a sit up, a crunch, that's an absolute no when you have this type of injury. And even if you do have a healthy spine, I would try and avoid those as it causes a lot of pressure through the base of the spine. So just make sure that you're keeping nice and upright. If you are having to sit, make sure you sit in a hard dining room chair, perhaps with a cushion on as well. and then keep on icing the base of the spine where the sciatic nerve comes out. So that's right on the back there, just above the buttocks, right where your underwear line should go. Tuck an ice pack in there for 15 minutes. So 15 minutes on, put it back in the freezer for 45, and try and repeat that as many times as you can through the day. Just ensure that you're wrapping that ice pack in a towel to avoid any skin burns. So if you like the video, please hit the like button, subscribe to the channel for our regular updates, and you can grab copies of my best-selling books here, The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery and Transform Your Back. See you soon.